Okay, so I will start now. Hello, everyone. My name is Amarjish Kadir. I'm the CEO of the company who would stop at nothing to get my goal. Our company strives to innovate the world through technology and artificial intelligence. This comes down to our company name, which is Intelliga, and our slogan is Let the intelligent machines do the job for you. Let's start with the facts and the figures and not the stories. There are 2,100 radiologists in Canada. Approximately 90 residents graduate each year in Canada. And it goes without saying that these students are not evenly distributed around Canada. So provinces with lower population have less radiologists and neurologists. In Canada, there are approximately 38,000 family physicians and 35,000 specialists, of which only 854 are neurologists. Intracranial hemorrhage bleeding that occurs inside the cranium is a serious health problem requiring rapid and often intensive medical treatment. The role of the radiologist is to detect the hemorrhage, characterize the hemorrhage type and the size to determine if the hemorrhage might be jeopardizing the critical areas of the brain that might require immediate surgery. Identifying the location and type of the hemorrhage present is a critical step in treating the patient. At Intelliga, we are focused on aiding the medical professionals, and one of the ways to aid medical professionals is to help them detect intracranial hemorrhage. In Canada, ICH accounts for 10 to 15% of all stroke cases presenting to hospitals, with a high death rate of 40% compared to the 15% to other types of strokes. The purpose of this business idea is to remove the role of man from detection purposes, to increase efficiency and save time and manpower. The task of detecting and identifying hemorrhage is very sensitive as it is a serious health condition requiring often intensive medical treatment. It requires very high precision and accuracy in very short time. Let's have a moment of life and death for you. You will now see a small task on your screen and you will be given 5 seconds to complete that task. If you succeed, you will get to live and see the rest of my presentation, but if you fail, you will die. Remember, you have only 5 seconds to live. So here's your task. You're supposed to find this man in small picture on the right and find him in the big picture on the left. Your 5 seconds starts now. 5, 4, 3, 2, 1. So how many of you were able to find the man in the picture? I assume no one, because the human eye is incapable of doing this in this very short time. Let's give you another chance to live. You have another 5 seconds to find out what is wrong with the numbers here. Another 5 seconds starts now. 5, 4, 3, 2, 1. So here are the mistakes which your human eye was unable to detect. Although every one of you know how the numbers work from 1 to 200. This is what happens when you have a pressure of time and the pressure of saving a life at the same time. The pressure on mind distracts your focus every time. But when you see that neurologists and radiologists live with this very pressure on their minds every day. Sometimes they are able to save the lives because they diagnose correctly, and sometimes they fail, which can put the life of the patient in danger. Diagnosis require an urgent procedure. But why put so much pressure on the minds of doctors and radiologists? Why not let the intelligent machines do this job for us? Hemorrhage detection is not an easy task, especially when the images are CT scans. A human can perform this task, but targets are not clearly identifiable from naked human eye, which results in delayed and poor results. Moreover, the identification and classification of hemorrhage is a slow process. It's a human eye that has to detect and analyze all the brain scales all day long, anytime 24/7. So inevitably, we often miss the important spots of injury. And there's a physical limit as well. Radiologists and neurologists need a fast, decisive, and inclusive system to make this decision at any time. Technology exists to help us overcome such human limitations, and intelligent technology can help us. So what is CT recognition? It is a software application to help analyze a brain scan. It comes with a desktop version, and it is a device that uses machine learning technology to continue to get smarter as it processes and analyzes more brain scans. Traditionally, the current procedure is to scan the brain physically and send the brain scan to the lab, and the results take time getting back from the radiologist to the doctor. We will make it adjustable for a simple personal computer, make this process more faster, more comfortable and pressure-free, and completely bypass the need for a radiologist and neurologist to analyze the scan. Nowadays, doctors use lab results to scan and to base their decisions. If the results are false, it can be fatal. So if we talk about the market gap, the urgency of the procedure and time-consuming decision-making process combined with a shortage in the expert radiologists and neurologists. Thus, a significant need for a computer-aided diagnosis tool arises to assist the specialist and resolve the conflicts. The fact that neurologists disregard the radiologist's report due to lack of trust and opinions. The neurologists are not infallible, so they are prone to make mistakes, especially when they're operating on a patient at 2 a.m. at night. Time critical situations, because brain is bleeding and the cells die in a matter of minutes, so every second counts. Currently, there's not a single such device out there in the health sector. So our product breakdown expense, the development of our software product comes down to these basic expenses. We will hire a medical expert team to review the results before we finally launch it in the health sector, because we aim to provide fast and accurate results. We will also have our research and development team, because we are dealing with the health sectors here. So we need proper research and development of our product. And there will be no initial cost of training our model, because we will be using a rich image data set provided for free by the Radiological Society of North America. So here is a breakdown of the expected labor cost. Normally in a large medical diagnostic device company, a typical software application developed by the company takes approximately 3 years to develop. But in our case, the breakdown of the cost is for 1 year, as we promise to deliver the product in 1 year. So how we will make money? We will not be licensing or outsourcing our technology. There will be a one-time initial purchase for installing the software system in the health sector. Then there will be an yearly software usage payment. And we will also be providing the training to the staff on how to use our technology. We will provide updates to the software. By the updates to the software, we mean that our technology is based on machine learning, means it can improve with time. We continue to improve our machine learning software and keep our prices at a reasonable level. Our idea is that products can be improved with new software updates, similar to how an iPhone continues to update its software within the same device with no further cost. Later, we will definitely work on other detection technologies like tumor detection and cancer detection. We will introduce another product after 5 years. So for the product margin, as the software comes with an initial payment and also the subscription fee to keep using our software, our gross margin for 1 year, if we target minimum of 2 health sectors in 1 year, will be around $784,000. If we sell the products to 10 medical sectors in 5 years, we will be making around $7 million in 5 years. Stroke is the third leading cause of death in Canada. And in our case, we are targeting all the hospitals worldwide. So the market is huge out there. This market, not just in Canada, but the whole world. Globally, there are 13.7 million new strokes in 2016, of which 4.51 million or 30% were the hemorrhage strokes. According to the Canadian Agency for Drugs and Technologies in the Health 2017, there are approximately 561 CT scanners and 366 MRI imaging scanners in Canada. Over 75 million CT scans are performed each year worldwide and are growing. So we can target all those 561 scanners and install our software with those scanners to analyze the scan and give immediate results. Yes, there exist competitors and research on this. But even though there exist competitors, why is this technology still lying in those papers? Why is this technology still not in the market or in the industry? Why the lives of millions of patients are not being saved by using this technology? Why a doctor and a radiologist feel immense pressure on his mind when he holds a brain in his hand? There exist other companies too, and they're taking steps to bring this technology to the industry. But those steps are not enough. We need to take a leap. So for the supply chain, we will start with Canada, targeting the medical industry and the health sectors of Canada. We will try to make it work according to how the health sectors work in Canada. We wish to support the local Canadian economy first instead of providing it overseas, then move to the USA. There we will be making our ground, and from that point, we will be targeting the whole world, every country in the world. So what we promise is a revolutionary CT scan analyzer that can run hundreds of tests using machine learning technology. We are aiming to start the funding round and to source funding to secure funding for our company. Radiologists make an average of $58,899 per year in Canada. Instead of hiring 10 human labor, in this case a radiologist, to double the speed of the process, this product is for $200,000 of subscription a year and will be 10 times faster than another human worker. We also have the willingness to compete and surpass the other companies. For the marketing and the promotion, marketing of the medical software will be done directly and not through advertising. We are planning on showing the health sectors firsthand exactly on how much we can help them and how much we can improve their lives in terms of reducing the stress on the neurologist and the radiologist, and how this technology can be used to save more lives in less time possible. So what makes us stand out? We'll be using the machine learning technology, which improves with time and gives better results. The patient will have a CT scan immediately. That scan will be processed through our software, which will point out the location of the hemorrhage and the type of the hemorrhage. We envision to perform the test on the spot and create a report instead of waiting for the results or sending it to the radiologist or the neurologist. CT scans are only the start. The potential applications of this technology are endless. MRI scans, medical diagnosis, cancer detection, tumor detection. Intelliga will enable all of these things. So I am elated to be part of this company. I hope that this exciting journey starts today. Thank you. So before I move on to the question, I would like to show a small prototype of my technology, which I was working on. If I have like 1 minute and a few seconds, I would like to show that.
Yes, you still have 2.5 minutes.
Okay. So I hope you are able to see this now. This is my prototype.
I think there's a background music.
Yes, there is a little.
Okay, it's a little bit too loud. It's kind of covering your voice, so maybe if you could speak a little bit louder.
So this is my prototype, which I have been working on because the goal is to detect the hemorrhage, but my technology is not yet completely successful. I'm still working on it. This technology, what I have succeeded is that I am able to detect the type of the hemorrhage and not exactly the location, but I can assure you that this technology can be improved. So this is the basic of what I'm talking about. part of success for my technology as a prototype. So that's it.
Awesome. That's the end of the 15 minutes. Feel free to jump into the Q&A and feedback. Awesome presentation, by the way.
Thank you. I think you had an excellent presentation, and I really love your idea and the application here. So, incredible job. I wanted to